Good morning, good afternoon,
bonjour.
good evening, colleagues. I am coming to you from the Philippines this month. I'd like to, I'm Brian Morales from the U.S. Department of State. I would like to welcome you all to the second meeting of Sub-Working Group 3.2 for the Global Coalition on Synthetic Drugs. Beginning this month of November through February, we'll be looking at specific initiatives available to us through international organization partners. We will also be exploring new activities or policies that we can initiate together. In January and February, we'll have the full menu of activities available for review, and we will invite you to express your interest to the international organizations who are managing the respective initiatives. Some other administrative announcements. Please update your screen name so it lists your name, organization, and country. In addition, the coalition website is very close to completion, so we will be launching that in the next few days. I know we've been talking about it for some time. We will be providing you an email with the URL, so that will be coming to you soon. And we'll be doing a lot of our work between the months of meetings on the website itself. Thank you all also for your feedback regarding the number of calendar invites we have received. We recognize that we have been sending many calendar invites to participants for meetings. So for the future, we are going to be sending one calendar invite for the entire block of the 3-hour meetings for sub-working groups 3.1, 3.2, and 3.3, as well as another calendar invite for the 4-hour block for the sub-working groups 1.1 to 2.2, if you signed up for any of those meetings. And we will be sending you the calendar invites for both East and West groups, so you can pick the ones that are most convenient. So it's not, we're going to reduce the number of emails of invites, but you will still be receiving, if you've signed up for working groups on both sides, you'll still be receiving 4 or 2 calendar invites. We're also still continuing to seek to increase coalition membership, to include stakeholders from all the different target audiences of synthetic drug issues. For example, other ministries like education and health and social affairs, women's affairs. So please continue to share coalition registration links with your colleagues so we can make sure that all the stakeholders from your governments have a seat at the table. I am also going to ask Sarah to paste the agenda for today's meeting in the chat so everyone can see that. And now I would like to turn it over to the co-chairs for today's meetings to call on presenters, share thoughts, and moderate the discussion. We have Nicolas Pris from France and Yuri Kutipe from Peru. Over to our organizers. Thank you so much.
Oui, bonjour Brian, j'espère que vous m'entendez tous.
Hello, Brian. I hope that you can hear me. Hello, dear co-chair Yuri. Thank you so much for this introduction to our new session. I'm so pleased to be with you again. And I just like to reiterate, I am a public health doctor, and I am also a specialist in Paris on addictive behaviors. I'd like to thank Yuri for his presentation. So we have several experts who are going to add to this discussion today. So hello, thank you so much. Good morning, good afternoon.
Muchas gracias, Nicolás. Buenos días, buenas tardes, según corresponda a los compañeros y compañeras que...
Thank you very much, Nicolás, Yuri, and all our colleagues participating in the meeting. My name is Yuri Kutipe. I'm an advisor of the Ministry of Health for Mental Health and Addictions. And I'm honored to co-preside with Dr. Nicolas Priste from France these meetings. This morning, we are going to share multinational experiences throughout the day on treatment of people who suffer from addictions, specifically training programs for government officials, health workers, and agents that work within the communities we will share with you 3 presentations, which you will find very interesting, I am sure, in terms of developing capabilities or competencies throughout the last few years throughout the world. Thank you very much for your presentation, Nicolas.
Parfait. Merci beaucoup, Yuri. On va peut-être passer la parole.
Thank you. I think we're going to give the floor to our first speaker, Giovanna Altamirano. So we have Monica Chupagea as well. She is going to present for Fariba Soltani, who is in charge of the HIV prevention at UNODC, HIV/AIDS section and global coordinator for HIV/AIDS. So we are going to focus on preventing HIV/AIDS among people using synthetic drugs. Thank you very much, Giovanna.
Thank you so much, Nicola and Yuri, dear co-chairs, distinguished participants, dear friends and colleagues. Thank you for giving UNODC the opportunity to present some of the tools that we have created and that are at the disposal of all the international community to improve all the services that are necessary to protect, first of all, the health of people who use drugs and people with drug use disorders, and then to improve it, and then, of course, to support, if they so wish, their recovery. You will hear from some of my colleagues, but for me, I would like to use just a minute of your time to stress how UNODC can support member states in improving all of these services, from the most low thresholds of outreach to opioid agonist maintenance, from psychosocial therapies to therapeutic communities and recovery management. In short, from harm reduction, including on overdose, HIV, hepatitis C, to treatment, to recovery support. And some of our member states do not feel comfortable with some of these terms, but please do rest assured that evidence-based practice covering all this continuum of services is supported by our guidance document, including the UNODC WHO international standards for the treatment of drug use disorders that you see on screen, as well as by the mandates and the commitments of our member states, such as the outcome document of the 2016 special session of the United Nations General Assemblies and many other resolutions. And with this, having given you maybe a bit of a framework, I'm very delighted to give the floor to my dear colleague Monica from the HIV/AIDS section, who represents our global coordinator on HIV/AIDS and the chief of the section, Dr. Fariba Soltani. And she will zero in on services, particularly focusing on prevention, treatment, and care of HIV/AIDS and other infectious comorbidities. Dear Monica, please do take over.
Well, so thank you for inviting me to present today. My name is Monica Chupagea. I'm the Global Thematic Focal Point for Drug Use and HIV in the UNODC HIV team. And as you know, UNODC is one of the co-sponsors of the UN Joint Program on HIV and AIDS, and is the agency that is mandated to work on HIV prevention, treatment, and care among people who use drugs and people in prison. So the topic of today actually is something that we are working on for quite a while. because it's obvious that the use of new psychoactive substances, the use of stimulants is spreading rapidly. And as many studies show, it's very closely linked with scaling up the number of people who are getting HIV or hepatitis due to the unprotected use of these substances. So what we did as a first step was to develop this technical guide on HIV prevention, treatment, care, and support for people who use stimulant drugs. And this guide is looking at 3 substances that are closely linked with the spread of HIV and the hepatitis, meaning amphetamine type stimulants, cocaine, and new psychoactive substances. In my presentation today, I will focus more on the work that we are doing on new psychoactive substances, but just to tell you that this guide that you see on your screen and that is available on our website is supported by a capacity building program with trainings available online or in person. And so far, we reached around 12 countries mostly affected by the use of stimulants with this training, and train a couple of thousands of people so far, mainly service providers, community representative of community-led organizations, and decision makers. So the same training was available, the same capacity building program was available in Eastern Europe and Central Asia, because this region is unique when it comes to synthetic drugs. Synthetic cations are very much spread in this region. The injecting is raising rapidly, and also the way people are, especially after COVID, the lockdowns, the way people are accessing these drugs, it's more different than what we've seen so far, meaning accessing via internet. So first we did needs assessment in 6 countries in the region: Moldova, Ukraine, Belarus, Kazakhstan, and Uzbekistan, focusing on what are the trends of use, what are the needs, what are people identifying as their main barriers and as the main needs. And again, these publications are available on our website on UNODC. The results of this need assessment show that among people who are using, there are a lot of gaps in knowledge and understanding of the health risks. Then it showed that for the service provider, including the health service provider, there is a lot of need for capacity building and for understanding the phenomenon. And then also in data collection, there are a lot of gaps and needs for improvement. And very often in this needs assessment, the issue of mental health services, the mental health issues that people who are using new psychoactive substances are facing and that are not looked in, and they will not receive support. Based on the needs assessment, following the way people are procuring the substances, it came out the need to do web outreach and to improve the technologies to provide more services for people who use new psychoactive substances and stimulants. And that's why it was developed an electronic guide for HIV harm reduction interventions, an animated learning videos explaining the harm reduction services, and recommendations for web outreach. And through this program, you can see here on this slide that we managed to reach a very large number of people. Almost 3,000 between 2001 and 2002 reached out for online consultations. 1,690 over received information and were referred to testing on HIV and hepatitis and sexual transmitted interventions, sexual transmitted diseases. And out of this, 155 tested positive for HIV, 38 tested positive for hepatitis, and 65 for sexual transmitted diseases. So, so this is in a nutshell, you know, the technical guidance, the capacity building program, the concrete interventions with web outreach. And for the next steps, we are working, while we are continuing the capacity building, both for community-led organization, for medical staff, for people working on web outreach, and for professionals, health professionals who are working on mental health disorders. We are also working to support the community mobilization. And the last but not least, to look for resources to fund tailor-made harm reduction intervention for people who use new psychoactive substances, as these interventions are very much underfunded in Eastern Europe and Central Asia, but also in other parts of the world. Thank you very much.
Merci beaucoup, Monica. Et merci également à Giovanna. Aviez-vous terminé votre présentation?
Yes, we have.
Thank you very much, Monica. Have you finished your presentation? Thank you. It was very important to emphasize at the beginning of this meeting the risk factors for drug use, particularly synthetic drugs, through the lens of infections such as HIV and hepatitis. Thank you for what you do. We're going to move on immediately to Anja Busse, who, as we all know, she's at UNODC working on treatment and rehabilitation. She is going to present today an initiative called SOS, Stop Overdose Safely, and it will be followed by a small film, but now we will hear from Anja.
Nous avons vu un message.
This is a film about life, about hope, of actions that make a difference. And it's about our future. It's also a story about people who help change lives, people who help save lives. And it's also about remembering, not forgetting. Remember the 500,000 mothers, fathers, sons and daughters who lose their lives to drug use every year.
It's not something that Jonathan did or didn't do. He was the son that any mother would have wanted her son to grow up to be. Unfortunately, we still don't know what makes someone vulnerable to develop addiction. He deserved to live a life like any of us. He would have been the kind of person that you would have interacted with in your daily basis and would not have thought twice that he had a problem, that he had this terrible, terrible disease. That's why his death was such a shock for our community, because he was a good person. He deserves a legacy, and I will make sure that he has that.
Each year, at least 115,000 people die from an opioid overdose. But we have the chance to reduce that figure. We have the chance to make a difference. And effective solutions already exist, most of which operate at the community level.
It doesn't just change an individual when you treat somebody with drug use. It changes a family, it changes a community. We have a team of outreach workers who go out to the community and identify these persons who have the need for methadone maintenance therapy, psychosocial support, and other interventions as per the assessment of their needs. Psychosocial intervention is quite a wide range, ranging from psychological services, social skills improvement, family integration, people who come when they are unkempt, they are dirty, they are homeless, they are malnourished, they come back and they restore their human dignity. It gives you job satisfaction because you go to work and you know you're going to change somebody's life.
This success story in Kenya is one of many community-based programs that is a cost-effective and high-impact solution. But there are many more successful initiatives happening all over the world.
Люди, когда приходят к нам, они привыкли к тому, что им никто не хочет помочь. И когда они видят принятие, поддержку и конкретную помощь здесь и сейчас, это очень подбадривает. Мы обучаем людей о том, что такое передозировка, то есть рассказываем, какие они бывают, какие симптомы и как можно помочь человеку, если вы увидели передозировку, если стали свидетелем передозировки.
Тоже рассказываю про налоксон, чтобы он был в доступе, как им пользоваться и чтобы избежать смертельных передозировок.
Наркозависимые люди, когда чувствуют принятие и поддержку, они готовы меняться сами и отдавать обществу тоже только хорошее.
People are helping people. Never has collaboration been more important. Ideas that have been approved at the highest level are working at local levels.
The SOS project, Stop Overdose Safely, is a really wonderful project. Within the project, we provided services to more than 5,000 people. We provided them with kits with naloxone and with unique training. We trained 5 master trainers and 54 national trainers who provided training to people who live with people who are under utmost risk of suffering from overdose. Without the support from WHO and UNODC, this project would be impossible.
Right now, we have an opportunity to realize that we can scale up overdose prevention activities. Today we can act to make a difference. Today we can help to break the stigma. Today we can stop thousands of unnecessary deaths. Drug dependence is not a choice. It never has been. It's a complex mental health condition and not a self-acquired bad habit. It can be prevented and properly addressed to improve life and well-being of people. It should be an integral part of primary health care and universal health coverage. Today, we invest. Tomorrow, we move forward.
Thank you so much for the possibility to present to you the UNODC WHO Stop Overdose Safely initiative, the lessons we have learned, the plans ahead, and of course the possibilities to join. You have heard several times that we are estimating around 60 million people worldwide have used an opioid in the past year, and that includes, of course, synthetic opioids. And about 500,000 lives are lost on an annual basis due to drug use, to which opioid overdose is an important contributor. At the global level, 2/3 of direct drug-related deaths are due to opioids, and in some sub-regions, the proportion can be as high as 3/4 of such deaths. The CND Resolution 55/7, the Commission on Narcotic Drug in 2012, gave a mandate to promote measures to prevent drug overdose, in particular opioid overdose, and has asked all member states to include elements for the prevention and treatment of overdose in their national drug policies and to share best practices and information around overdose management, including the use of naloxone. CND Resolution 55/7 also requested UNODC in collaboration with WHO to include initiatives to prevent mortality from drug overdose, in particular overdose, as part of our demand reduction programming, which we then have done with the SOS initiative. All of this has been further strengthened by the ANGA's 2016 outcome document that said how the promotion of national drug policies of prevention and treatment of drug overdose, in particular opioid overdose, and the use of the opioid receptor antagonist naloxone to reduce drug-related mortality would be of high importance. In 2014, then WHO issued guidelines on community management of opioid overdose that include as a first recommendation that people likely to witness an opioid overdose should have access to naloxone and be instructed in its administration to enable them to use it for the emergency management of suspected opioid overdose. And then UNODC and WHO launched the SOS initiative with a goal that 90% of people likely to witness an overdose should be trained, 90% of those trained should be supplied with naloxone, and 90% of those supplied with naloxone should also carry it with them to respond in case of a suspected overdose. The SOS study with which we have demonstrated all of this took place from 2016 to 2021 in Central Asia and Eastern Europe. And here you can see some of the results. With a good level of preparation, in only 6 months, we have trained over 14,000 people likely to witness an overdose, disseminated 34,000 ampules of naloxone, and 90% of the project's participants recorded using naloxone and witnessed overdoses. So we have also reached our 90-90-90 targets and demonstrated their feasibility, as also in almost all instances, further, the victim was reported to have survived. So estimations suggest that in the project, around 4,000 naloxone uses took place in only 6 months, and we estimate a high number of lives saved. Also note that with this, we have demonstrated that take-home naloxone schemes are feasible and save lives in lower middle-income countries where before systematic evidence of this was lacking. So some of the lessons we have learned to share here with you was the strengths of 2 UN agencies, UNODC and WHO, working together. And there was a paramount role of involving national authorities early and engage them and have their buy-in. Other kind of parts were also important, like the consideration of the legal context, the availability of naloxone, a training cascade going down to very short and simple to deliver overdose trainings, and a mapping of drug treatment services for further linkages to additional support, for example. So now, if you want to join the SOS initiative, be informed that we do have training materials and a capacity building strategy ready to share and implement and work with you. We also have available the specifications of an SOS naloxone community kit that obviously can be adapted further, including depending on what type of naloxone formulation is available. And we do have assessment tools to prepare and understand the situation at the beginning, as well as an implementation study protocol for further data collection, monitoring, and evaluation. So our future plans include going from SOS, Stop Overdose Safely, to SOS for Life in this area of opioid overdose prevention. We want to implement, and we hope on your interest and support, the SOS for Life initiative in other countries. It's really a very doable way to save a lot of lives in short time. Furthermore, we want to include aspects with a view to the criminal justice system, to substance use in humanitarian settings, and to settings with high synthetic opioid prevalence further in the SOS toolkit. We will also include the SOS considerations in the implementation tool for the international standards for the treatment of drug use disorders, and updates, including on synthetic opioids, will make it when WHO is now updating different guidelines related to opioid use and opioid use disorder treatment. And last not least, the SOS for Life will extend SOS in terms of more comprehensive responses across the board. So this one we will not have time for. This is a film about life, which we recommend you to see here at this YouTube link. It demonstrates and showcases the importance of saving lives through effective treatment and emergency responses, including in low middle income countries. So please do join us, join the SOS for Life initiative. Here you find my contact details and the contact details of our colleague Dimitri from the World Health Organization. With that, thank you very much and hope to talk to you soon.
without any transition, I'm going to pass the mic to Rodrigo Portilla, who has managed to join our call and present live. Rodrigo is the head of, he's going to explain to us the Colombo Plan Office. Thank you very much for your presence, Rodrigo.
Thank you, Nicholas. Sarah, can you help me with the slides, please? Fantastic. Perfect. Thank you so much. Good morning, good afternoon to you all. It's a pleasure for me to be here with you. I would like to share the curriculums of treatment and recovery under the Columbus Plan with you next. And this is a major contribution to strengthen and consolidate the labor force of people who provide care to people who have the drug use disorder. Next slide. The universal treatment curriculum is before you. The UTC, as we can see, this is a fundamental course used for every professional or care provider who is at a treatment center, and so they can provide a better care to these people. And it consists of 8 courses, and we will briefly broach them. First has to do with physiology, how the substance goes into the system and the person. This curriculum covers the path that people follow as they go into the center in a more systemic way within the sector. Third one is the high prevalence of this community, the psychiatric and psychological community, and we will approach it in a more comprehensive way. And the fifth one has to do with developing family, local people, and the fifth UTC has to do with the intake, screening, assessment, treatment, planning, and documentation from the time the person goes into a center, and how a personalized plan for every individual is developed, how it is implemented for treatment and recovery. The sixth has to do with case management. How can we possibly facilitate the transition of the person through all the systems, the criminal justice system, into the center. The seventh, crisis intervention, especially in the case of suicide, and the UTC 8, which is key, is the ethics for addiction professionals, how these people can develop their own ethics code so they can provide the clinical attention. Next slide, please. And we will go into some specialized UTCs designed for population with specific needs and sensitivities. And this was created to raise the understanding of the specific needs of treating women in a comprehensive way. And it consists of 4 elements. First, the basic necessary skills to treat women from use, start of use, treatment and recovery, and also other key aspects for the care teams. And the next one has to do with how this is integrated to women's treatment and some approaches to improve upbringing, how to also involve the family in the treatment.
From childhood, pregnancy, what happens after pregnancy, and how to incorporate the treatment. Also, specifically about women that don't live in the home or that are survivors of conflict, or also the fourth course has to do with the way to implement programs of intervention centered on women. Next slide. This is a very interesting course known SWG, And this gives a general vision to participants of the health considerations, prevention, treatment that has to be taken into account to give more tailor-made services to different groups of people. Next. Please go back one. No, go back, not forward. No, isn't there another slide? Oh well, there should be another slide. I had to mention that that's a course for male treatment and masculinity. Most of the people that we see in the center, about 85% are men. However, there is no specific curriculum for them. So we have developed this course. And what you see is that we are trying to look for the characteristics of traditional masculinity and their effects on their health and consume of men. This will allow us to recognize and incorporate treatments according to the needs and preferences of men, and that way have a more sensible and balanced program for the care of men. And now what we have on the screen. This curriculum has 3 courses, and what it touches is upon social problems, economic problems. During the professionalization, we work on prevention and treatment, promoting the participation of communities to have a process in the rural areas. Because at the end of the day, what we try to do is to create the basic needs to develop and support community. Then we have the recovery series that talks about the basic needs to work as the recovery professional. And it has 2 courses. The first one is a model that is based on peer experiences, and it's geared to people that are on sustained recovery or those that have been impacted directly or indirectly by drug consume. The second one is geared to people that do not self-identify as people in recovery, and it can be implemented independently. It's designed to be done quickly and easily for people who want to do it on their own. And it has a summary of the curriculum that we can offer to those countries interested, and we could work with you on this if you want us to, and thank you very much.
Hola, soy Luis Torres, especialista.
I am Luis Torres, specialist on demand reduction of the Anti-Drug Commission in El Salvador. I want to talk about our implementation of curriculum program that we have prepared with the support of Colombo Plan. This has been done by our executive director starting in 2021 when we received a communication online certifying 12 professionals as UTC trainers. The first one was in person, and it was supported by Colombo Plan, graduating 34 individuals who have theoretical and practical knowledge on this subject matter. And they have been working on implementation plans to improve the attention and services. On behalf of my country, I thank the Colombo Plan because the process allows us to strengthen the services, motivating those that we accompany people with a problem of substance abuse. Hello, colleagues. I am Roberto Enriquez from Ecuador, and I wanted to share my experience of the universal curriculum treatment. In 2020, we started a trainer of trainers team with physicians, psychiatrists, psychologists, technicians, and during 86 hours, they were able to strengthen the response capacity and develop a national level team that helps us to work replicating this universal treatment program. This was developed in 2022, 120 hours of hard work, people from the health sector participated, local governments, private sector, universities, doctors' offices, psychologist offices, and others. And at the end of the day, we had 29 professional individual teams, and the result was to strengthening the capacity to respond, better treatment, and also to have a national level professional team, always oriented on recovery, which is a big challenge for our national systems, to strengthening treatment and interdisciplinary programs, working together with social services agencies. We invite other countries to follow this initiative to be able to increase the quality of life of our users that are facing these problems of drug consumption.